The colon, or large intestine, is the final stop in our digestive system where a lot of the fluid or water is reabsorbed from the stool. There are several diseases that can affect the colon. Benign diseases such as diverticulitis, which is an infection of the colon, or volvulus, where the colon has actually twisted upon itself, can ultimately lead to the need for surgery and removal of a portion of the colon. Obviously, colon polyps and colon cancer, which can be found usually by colonoscopy, can also require surgery and removal of a portion of the colon. Traditionally, this operation was done through a large open incision or laparotomy and could require a stay in the hospital of several days, even up to a week or more. Since the 1990s, more and more colon surgery has been done laparoscopically using minimally invasive techniques. Instead of one large incision, we make several small incisions on the abdominal wall, inflate the belly with carbon dioxide gas, and put a camera in order to see structures within the abdomen. Several of the benefits of laparoscopic surgery include decreased scarring, which is important for many patients. We also see significantly less pain with laparoscopic surgery, which means a shorter hospital stay, less need for pain medication, and an overall much quicker recovery. Many of the operations that used to require a stay of several days in the hospital can now be routinely and safely done as an outpatient. One of the most recent advances in laparoscopic surgery has been the introduction of the surgical robot, or the Da Vinci robot. We use the same laparoscopic techniques to gain access to the abdomen, but then we attach the robot to the surgical instruments, and the surgeon sits in the room and controls the robot. We gain a couple advantages with this new technology. We're able to see again in 3 dimensions, whereas before with laparoscopic surgery, we were limited to 2 dimensions. We lost our depth perception. We also have wristed instruments, which allow for much better articulation and much more precise dissection. The real advantages of using this technology are in the more complicated laparoscopic cases, where the anatomy can be challenging, potentially even could cause us to convert to an open operation, whereas now we're able to complete the operation safely using the minimally invasive techniques with the robot. And that leads to, again, better patient outcomes, less pain, and in a lot of cases, less potential for complications after the surgery. Each of the partners in our practice has experience with both open and laparoscopic colon surgery. And in discussion with the patient, we're able to help determine what the best operation would be on an individual basis. More information on many of these topics can be found on our website. It can be helpful to review some of the information on the website before coming to your appointment so you can have a more informed discussion with your surgeon.